Hi there, my name is Coral Hawking and I'm going to be your student of physical therapy today. How are you feeling?
I'm good.
Good, and I'm just going to confirm your name and date of birth on your hospital bracelet here. Can you tell me what your name is?
Ricky Stiff.
Alright, and your birthday is 9/8/1970?
Yeah.
Alright, awesome, and that matches my records here. So you did have a spinal surgery yesterday, right?
Yes, ma'am.
And you had a lumbar fusion. So what we're going to do is I'm just going to take a couple of your vital signs. We're going to go over a little bit of what happened with your surgery. And then I'm going to teach you how to use this brace here. We're going to get you up and moving and walking, and so you can get home and take care of your mom as soon as possible. Does all that sound okay?
Yes, ma'am.
And it's okay if I treat you today? Alright, awesome. Thank you so much. So I'm going to start by taking your blood pressure, and we're going to make sure to do it opposite of the arm of your IV. Does that feel okay?
Yes.
And relax. Ready? Over 58. Get a rating of your pain right now on a scale of 1 to 10.
About 5.
Okay, good to know for now. That's not a temperature. I'm just going to go ahead and put this underneath of your tongue. And we have a little sanitary thing here. Open up. Just stick that underneath your tongue and close your mouth. Open back up. Thank you. 98.6. 6. Awesome. Go ahead and throw that away. And the next thing I'm going to do is just take your heart rate. I'm just going to relax your arm. And I'm going to use my little timer. Thank you. You go ahead and put it down really quickly. Okay, so I just want to give you a little bit of information about what your doctor and your surgeon said about your protocol for the next couple weeks. So they want you to avoid bending over, twisting, lifting, and pushing and pulling things about 15 pounds or more for about 12 weeks. They want you to limit your time sitting, which includes time in the car, for no more than 30 minutes at a time. And if you do go somewhere or you have to sit for a long time for work or something like that, they want you to stand up and take breaks just so you're not sitting for a long period of time. Does that make sense?
Yes, ma'am.
Okay. Are you feeling okay?
Yes, ma'am.
Okay. So the next thing that we're going to do is I am going to kind of work together with you, and we're going to get you on your stomach so I can take a look at your scar and your incision, kind of feel around back there a little bit. Is that okay with you?
Yes, ma'am.
Alright, so what we're going to do is I'm going to scooch you this way, and then I'm going to roll you all at once over onto your stomach, okay? And it's really important that everything moves at the same time, alright? Alright, so what we're going to do is I'm going to move here, sorry, and here, and then the feet, and we're going to have to move your leg, okay? Alright, ready? 2, 3. 1, 2, 3. 2, 3. Alright. We're going to roll on the count of 3 here. Ready?
Okay.
1. And you can go ahead and just bend your knees a little bit for me. Ready? 1, 2, 3. Good? Are you alright?
Yes.
We're going to go ahead and roll the rest of the way. Ready?
Okay.
1, 2, 3. And I can move your arm for you. And how does that IV feel there, okay?
It feels good.
Alright, good. We're just going to move that out of the way here. And what I'm going to do is just, can I lift up your shirt a little bit so I can see your scar? Move your gown out of the way. Okay, things are looking good. I'm just going to take a little measurement here. about 10 centimeters there. It has a little bit of redness, but that's completely normal. And what we're gonna do is, this is a little Q-tip, and this is just kind of what it feels like. So this is me touching you, and this is me not touching you, okay?
Okay.
And this is what it feels like when I touch you and I not touch you. So I want you to kind of close your eyes, and we're gonna do a trial run. I want you to say yes if I'm touching you, and no if I'm not touching you, okay?
Okay.
All right, ready?
You're touching me? No. Yes. No. Yes. No.
Okay, so that was the trial run, and now I'm gonna kind of do the same thing on your lower back and your legs, okay?
Okay.
Ready?
Yes. No. Yes. No. Yes. No. Yes. No. Yes. No.
Can I lift up your shorts a little bit?
Yes. No. 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 Yes. No.
May I tickle a little bit?
Yes. No. Yes. No.
Awesome. All right, good job. Okay, we're gonna just feel around a little bit more before we do that, okay?
Okay.
And I want you to tell me when it hurts, okay? Does that hurt?
No.
And how about that?
Little.
A little bit? And how about here?
Yes.
Yeah, right there?
Mm-hmm.
Okay, and how about here?
Yes.
Okay. And how about here?
Not really.
Here?
No.
Here?
No.
Here?
No.
Here?
No.
No?
No.
No?
No.
Okay, thank you. And, okay, so now the next thing we're gonna do is, I am going to teach you how to put on and off your brace.
Okay.
So what we're gonna do is I'm going to put it on your back. We're gonna go ahead and roll you on your side again. I'm gonna go ahead and put it on your back, and then we're gonna roll you back on your back, and I'm gonna strap it to the front. Once we do that, I'm gonna teach you how to take it off, and then we're gonna try to do it without me helping you as much the next time, okay? Your brace, I'm gonna show you what it looks like first. So it goes around you like this. And then there's just little straps in the front here, and they're just gonna buckle together like that, okay? That's exactly what it's gonna look like on you, and it's just to keep everything straight and to make sure that your incision heals properly and that we don't do any unnecessary movements with your back that might hurt the surgery, all right? So this brace is a little bit different, so we're actually gonna start with you on your back for it. What we're gonna do is just slip this arm right through. Is that okay?
Yes.
I think it's getting stuck. There it is. There it is. Alright, and then we're going to take this arm and just stick it through the other hole. And then on the count of 3, what we're going to do is something called a log roll. I'm just going to lift you up just a little bit and sneak this underneath of you. Is that okay?
Yes.
Alright. On the count of 3, we're going to do something called a log roll, and I'm going to roll you all the way, and we're not going to let any twisting happen in your torso, okay?
Okay.
Ready? 1, 2, 3. Good, good. Go ahead and lay flat, and now we're going to put the front part of it on. Very nice. So these straps come around, and they're just going to buckle up. 1, 2, 3. Okay? Does that feel okay?
Yes.
So the brace is to be worn at all times, and that's just to make sure that no unnecessary twisting happens and that we can protect your spine, okay? Tell me yes or no.
Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No. Yes. No.
Awesome. Good job. And I'm just going to pop you a few things on the front of your legs this time, okay? Does that hurt?
No.
Does that hurt? Any pain?
No.
Nothing? Good. Any pain?
No.
No?
No.
No pain?
No.
And no pain?
Okay.
Okay. Awesome. Good. Pick up your leg. Okay, ready? Don't move you down. Hold, hold. Good. Your leg. Hold, hold. Good. Down. Don't move me. Are you alright? Okay. Put your toes towards your head. Don't let me move you down. Good. Point them towards me. Don't let me move you up. Awesome. Point your toes towards your head. Good. Towards me. Awesome. Good job. Don't let me move you out. Good. Don't let me move you in. Good. Don't let me move you out. Good. Don't let me move you in. Awesome. Alright. So I'm going to go ahead and scoot you over to the edge of the bed here. All right, awesome. Thank you so much.
Action.
So the next thing we're gonna do is get you to stand up. Is that okay with you?
Yeah.
All right, so first we're gonna work on sitting up. So I'm gonna scoot you to the edge of the bed, and then I'm going to have one arm underneath of your legs, one arm behind your back, and on the count of 3, we're gonna sit up, okay? Does that sound good?
Yeah.
Okay. So I'm just gonna scoot you to the edge here. And just a little bit more. Actually, oh. Good. All right, we're gonna roll you to the side, and then I'm gonna stand you up, okay? And we're gonna do that same log roll technique, okay? Ready? 1, 2, 3. Awesome. You're getting really good at that.
Thank you.
All right, the next thing I'm gonna do is just make sure that this stays up and everything stays in line. And I'm going to come underneath here, and we're gonna sit up, and you're gonna swing your legs over on the count of 3. And I want you to help me as much as you can, okay? 1, 2, 3. Awesome. And how are you feeling? Good. And you feel like, are you dizzy?
No.
And you feel like you can sit up?
Yeah.
All right, on you, so I just want you to go ahead and reach your arms kind of out to the side. I'm gonna come around here. And down. Good. And how are you feeling?
Okay.
Yeah? And can you give me a pain rating?
It's about 6.
Awesome. Just keep me updated with that pain, okay?
Okay.
I think we are twisted here.
You fine?
You okay? Alright. Good. And how does that feel?
Feels good.
Okay, good. You didn't know you're gonna get so many accessories today, huh?
No.
Alright. So to just neutral, go ahead and reach your left arm up as high as you can. And back down. Out to the side as high as you can. And back down. Go ahead and reach your right arm all the way up. Back down. To the side. And back down. Awesome. Now I'm going to have you put your arm like this. You can start with your left arm and put it out your side. I don't want me to move you out, okay? Good. Don't move you in. Awesome. Other arm. Don't move you out. Good. Don't move you in. Good job. And go ahead and put them at your sides. And go ahead and move your left arm in and neutral. Move it out and neutral. Awesome. This arm in, neutral, out, neutral. Awesome. Alright, I'm gonna do the kind of the same test with your legs, okay? Don't let me move you in. Okay, ready? Hold, hold, hold. Good. Go ahead and keep going out. Don't let me move you down. Don't let me move you up. Awesome. Other leg, keep going up. Don't let me move you down. Don't let me move you up. Awesome. Flex this one. Don't let me move you. Good. And go ahead and put it out. Don't let me move you up. Awesome. Flex it. Don't let me move you down. Go ahead and put it out. Don't let me move you up. Awesome. And then go ahead and I'm going to try to bend your wrist backwards. I don't want me to let you, okay? Good. Try to bend it up. Awesome. For the wrist. Good. I'm gonna have you just scoot back on the bed just a little bit. Here, let me help you. We're just gonna let me scoot you back. Okay? We're gonna go ahead and lean to this side. And then we're gonna scoot you backwards. Sorry. Lean to this side. And scoot you backwards. Is that okay? Alright, so your feet are a little bit off now. You feel stable?
Yes.
And are you dizzy?
No.
Good. 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 Awesome. We're gonna work on standing up, okay?
Okay.
Alright, so I'm gonna scoot you back to the edge of the bed just the same way I did. I'm gonna just stick my hand underneath of you and we're just gonna scoot forward, okay? So go ahead and lean towards the head of the bed. And scoot you down, other way. Alright, good. And so we're gonna be walking using a walker, so I'm first gonna show you how to do it. And I want you to just go ahead and hold on to the side here.
Yes, ma'am.
Okay. So you're gonna have your hands on both sides, and you are going to put it in front of you, and then take 2 steps towards it. Okay?
Okay.
In front, step, step. So it's the walker first, and then both of your legs. Okay? All right. So I'm gonna help you up, and then I'm gonna be guarding you the whole time, so you won't fall. Okay? All right. I'm gonna help you up, and on the count of 3, we're gonna stand. Okay? 1, 2, 3. How are you feeling?
Good.
Feeling all right? Do you feel like we can walk over to the walker?
Yep.
Let me bring it to you. All right, go ahead and grab onto both sides. We'll have to get that adjusted for you the next time. Yeah. Step, step, and then the walker. Step, step. Real quick. 100. Okay, I'm just gonna take your temperature one more time. You don't mind. Okay. Ooh, what is happening here? There it is. I'm just opening your mouth. 98.6. Awesome. And we're just gonna take your blood pressure one more time on the arm that does not have the ID. Head. Does that feel okay? Just go ahead and relax your arm. Right side over 58. And we're just going to scooch you to the edge of the chair. And then to the other side. Alright, and put your feet together kind of here. Ready? 1, 2, 3. Awesome. Alright, and I'm going to be walking behind you with your IV. And we are going to start. Okay. Good action. So I just need to take your vitals one more time. So one in the mouth. And close. 98.6. Good. Okay, we're just going to check our oxygen one more time. 100. Awesome. And blood pressure. Can you give me a reading for your pain?
About 6.
Right, good. Does that feel comfortable on you? Can you watch your arm? Right side over 60. So you did an awesome job today. This was the first visit, and I have really good expectations for your progress here in the hospital. What I'm going to do next is just teach you how to take off the brace, okay? So what we're going to do is have you just unsnap this and this. I'm going to go ahead and put your arm here, and I'm going to roll you to the side. We're going to take one arm out. I'm going to roll you all the way over, and then we'll take the other arm out, and then we'll roll you back over, okay? Same log roll technique. Ready? 1, 2, 3. Awesome job. We're going to get this first arm out here. Good. And then 1, 2, 3, all the way over. Awesome. Good job. Go ahead. All right. So on the count of 3, what we're going to do is I'm going to take your arm and just move it a little bit closer to you. I'm going to move your upper body and your lower body again at the same time, so nothing twists, and then we're going to put that brace on your back, and then we're going to flip you the rest of the way over, all right?
Okay.
Are you ready?
Yes.
1, 2, 3. Good. 98.7. 100. Alright, and just flip your arm for me for a minute. Good. Just relax it. Awesome. Does that feel okay on your arm?
Yes.
Good. Oopsies. There it is. Okay. Right side over 58. Okay. Alright, so the last thing I want to do is just talk with you about your discharge planning. I think that you have a great prognosis here from what you told me about your wife working full-time. I think once we discharge you from the hospital, I'm going to recommend inpatient rehab for just a few weeks to make sure that you're independent with the things that you need help with at home. That way you can do them by yourself when your wife is at work, and then you should be discharged home after that, depending on what the inpatient care has for you. But that's my plan. Does that sound okay?
Yes.
All right. Well, thank you so much for your time, Mr. Ricky, and we will go ahead and we'll see you next visit, okay?
Okay.
All right. Thank you. Hi there, Mr. Ricky. How are you feeling today?
Feeling good.
Yeah, did you feel okay last night?
Yes.
Okay, and how's your pain level today?
About a 6.
About a 6? All right, do you mind if I just check your bracelet real quick? And can you tell me your name?
Ricky Stiff.
And the birthday is 9/8/1970?
Yes.
Awesome. All right, thank you so much. Well, I'm just going to take a little bit of your vitals. And did you get some sleep last night?
I did.
And I heard they had eggs for breakfast this morning.
Yes.
Yeah, did you enjoy those?
Yes.
Cool, good. I'm just going to take your blood pressure really quickly. Go ahead and just relax your arm for me. Ooh. over 60. Good. Relax. And did the doctor come see you this morning?
He did.
Alright, and how was that?
Okay.
Beep. 98.6. And go ahead and spin your finger real quick. And about 100. So you are doing awesome. Do you have any questions for me today?
I don't.
What?
I don't.
Okay, well what we're going to do today is I'm going to get you up again and we're going to just work on some mobility and some transfers so you can be independent when you go home, and we're going to work on going just walking into the bathroom, and possibly some stairs. Does all of that sound okay with you? The first thing that I'm going to do is just flip you over onto your stomach so we can just take a look at that scar and make sure that everything's healing properly, okay? I see you have your therapy dog with you again today. We're going to do that log roll technique again, and I'm going to roll you onto your stomach so I can look at your scar, okay? All right, ready? 1, 2, 3. Good. Are you all right?
Yes.
All right, and then the rest of the way, just 1, 2, 3. I'm gonna get that arm out. Awesome. Are you feeling okay?
Yes.
All right, and I'm just gonna take a look at that scar. Is it okay if I lift up your shirt?
Yes.
Okay. All right, and we're still at 10 centimeters, so everything is looking good. There's a little bit less redness than there was yesterday, which is good. Everything's healing properly.
Okay.
All right, and I'm just gonna roll you back over, and we're gonna do some range of motion with your legs, okay?
Okay.
All right, ready? We're gonna do that same technique. Are you ready?
Yes.
1, 2, 3. And then ready? 1, 2, 3. So we're gonna try the brakes again, but this time we're gonna try to make you a little bit more independent with doing it. So I'll be here to help you if you need me, but I'm gonna have you try to put it on more by yourself this time. Is that all right?
Yes.
All right, so what we're gonna do is I'm gonna roll you to your side, and you're gonna put on one sleeve. I'm gonna roll you to your back. You're gonna put on the other sleeve, and then when I roll you back, I want you to try to fasten it, okay? All right, so I'm gonna go ahead and just flip this to the side, and we're gonna do that log roll technique again. Ready? 1, 2, 3. Awesome. All right, I want you to go ahead and just try to put your arm through the hole. Good. Does that feel all right?
Yes.
All right, and then we're gonna roll to your stomach, all right?
Okay.
1, 2, 3. Awesome. And I want you to go ahead and try to put your arm through the other hole. All right, I'm gonna go ahead and lay this flat here. You feeling okay?
Yes, ma'am.
All right, and then we're going to go ahead and put this arm down all the way. Relax. And we're gonna roll back, okay?
Okay.
Ready? 1, 2, 3. All the way. Awesome. Good job. And then can you go ahead and try to fasten it for me?
Yes, ma'am.
Good. All right, yeah. Very nice. So you did a really good job with that this time. So you are getting more independent with it. So we're just going to do a little bit of lower extremity range of motion. So what I'm going to do is just pick up your leg and just move it back and forth. Is that okay with you?
Yes.
All right, ready? Is that okay? We just want to make sure that everything below your spine and above your spine is going to stay kind of flexible and make sure everything's moving okay, all right?
Okay.
That feel okay?
Yes,
And do your other leg. All right, and next we're just gonna do some ankle pumps. So I want you to take your toes and point them towards your face. And then point it towards the wall. And repeat. And point it towards the wall. Good, and your other foot. And towards the wall. And towards your head. And towards the wall. Awesome. So the next thing we're gonna do is kind of get you up and moving. I'm gonna scoot you to the edge of the bed. We're gonna sit up. Then we're gonna stand up and try to walk to the bathroom and sit down so we can kind of practice getting up and down from chairs. Is that all of that okay with you?
Yes.
All right, so the first thing we're gonna do is roll you to the side and sit you up, all right? We're gonna do that same log roll. Ready? 1, 2, 3. Good, and it's that same thing. I'm gonna come underneath here and underneath your legs, and I want you to help me as much as you can, okay?
Okay.
Ready? We're gonna sit up on 1, 2, 3. Awesome. You feeling dizzy? You feeling all right? And we're just gonna go ahead and put the gait belt back on you. Go ahead and just put your arms up and back down. Awesome. And can you give me a pain rating?
Nice.
All right. Good. I'm glad to see that it's not changing. Just gonna tuck this in here. Are you dizzy?
No.
Good. What we're gonna do is just sit you up here. So you're already scooted close to the edge of the bed, which is awesome. So on the count of 3, your feet planted on the floor, and we're gonna lean forward and stand up. Ready? 1, 2, 3. Awesome. And from clinical judgment, he no longer needs a walker, so we are going to try to ambulate just with no assistive device, and I'm gonna help you, and we're gonna walk to the bathroom, okay? Right. All right. Feeling okay? And are you dizzy? All right, good. We're just gonna walk right into the bathroom here. The therapy dog goes everywhere with us. All right, just go ahead and hold on to the counter. And what we're gonna do is I'm gonna set this down here. We are going to turn around. And I want you to back up until you feel the toilet right there behind your legs. Do you feel it? Go ahead and stand right in front of it. All right, good. And on the count of 3, we're gonna try to sit down, okay? And you're more than welcome to hold on to that counter. Ready? 1, 2, easy down. Good job, awesome. And are you feeling dizzy? Do you feel like you need a second before we get back up?
Yes.
All right, so let's hang out here for a second. Okay, all right, let's go ahead and stand back up. Ready? 1, 2, 3. Good, awesome. And we're gonna go ahead and go back to the bed, okay? Go ahead, and once you feel that behind you, we're gonna sit back down. Awesome, good job. So we're just gonna do some stair training. I want you to just go ahead and hold on to that railing, and you can stand as close to it as you need, and we're just gonna do 1 foot at a time, okay? And whenever you're ready, you can go ahead and go. Ready? Good. Good. Awesome. All right, and then we're gonna turn around, and I'm gonna go ahead and just come on the other side of you, okay? And go ahead and grab onto that railing again, and just give me 1 second to switch this. Awesome. All right, and go ahead and go back up. Good. Good. Awesome, good job. Okay, go ahead and we're just gonna sit down.
Okay.
Awesome, and then we're gonna go ahead and lay down. So on the count of 3, we're going to lay you on your side. All right, ready? 1, 2, 3. Awesome, and then we're gonna lay you on your back. Ready? 1, 2, 3. Good. All right, we're gonna practice taking that brace off now by, I'll be here if you need help, okay? So you're gonna go ahead and undo that first strap. And undo the rest of them. Good. We're gonna go ahead and I'm gonna turn you on your side. Actually, let's scoot you towards this way just a little bit so it gives us a little bit more room for safety reasons. And then I'm gonna move your therapy dog. Good. We're gonna turn you on your side, take 1 sleeve off, turn you on your back, and we'll get the rest of it off you. Okay, ready? 1, 2, 3. Okay, and I think your wife will be able to help take it off of you. You did pretty good putting it on, so let's go ahead and roll you on your stomach. 1, 2, 3. Good, and we'll get that other one off you. Awesome. Go ahead and throw that out of the way. And then we're gonna roll you back. Ready? 1, 2, 3. All the way. Good, you did awesome. So I know it's a little bit harder to get off, but I think your wife will be able to help you when she gets home from work at the end of the day. Is that right?
Yes.
But you did good with putting it on in the morning. I'm just going to take a few of those vitals one more time. Can you open up your mouth? Beep. I need a 0.6. Go ahead and give me your finger. 100. And we'll take that blood pressure one more time. Head and just lift up that arm and put it down. Are you feeling okay? You feeling dizzy or anything? Good. Over 60 is good. It seems to be about normal. So the last thing I want to do with you today is just go over those precautions one more time. So can you tell me what the doctor said you're not supposed to do?
I'm not supposed to bend, lift, and twist.
Okay.
Or push and pull over 15 pounds.
Okay, and how about sitting?
I can only sit for 30 minutes.
And what if you need to sit more than 30 minutes? You gonna take breaks?
Yes.
All right. So I think that you did great, but I still think that we're gonna still discharge you to that inpatient rehab so we can get you a little bit more independent with your ADLs and other things that you can do at home when your wife isn't there. Does that sound okay with you?
Yes.
All right. Well, thank you so much, Mr. Ricky, and it's been really nice working with you, and we will see you next time.
Thank you.
All right.